Hi, my name is Rochelle. I'm going to be your very student nurse today, and I'm going to be performing your head to toe assessment. Is that okay with you?
Yes.
I'm going to perform my hand hygiene for 15 seconds to 30 seconds, and I will put gloves on, don gloves on. So I'm going to start my assessment with her general appearance. So the patient is, so before I start my assessment, I just want to identify who you are, okay? What is your first and last name? And I'm just going to check your wristband. Okay, it matches. So now I'm going to perform a general assessment before I start the head to toe. The patient is communicating properly, using proper words. Her mood seems okay. She's dressed properly for the coming to the checkup. The patient is awake, alert, and oriented ×4. Now I'm gonna start assessing the patient's head. So the patient's hair is evenly distributed and it's brown in color, and there's no visible masses or lesions on her head or her face. Okay, I don't feel any lesions upon palpation, and I don't feel any bumps or any bruising. So when I see her face, like I said, there's no observable lesions or bumps or anything. So now I'm gonna go ahead and assess the eyes. First, we're gonna inspect the eyes. The eyes are symmetrical and there's no discharge. Can you just pull your your eyes down? So I observed the conjunctiva is moist and pink, and there's no drainage coming from her eyes, no lesions on the skin around her eyes or on the eye. So I'm gonna go ahead and do the cranial nerve check. Check cranial nerves 2, 3, 4, and 6. So I'm gonna start off with the cardinal gazes. Just keep your eye on here. I'm gonna do the pinwheel method. Perfect. And now I'm gonna go ahead and do the accommodation test. So keep your eye on the pen. Okay, the patient eyes constrict as I get closer, and as I move the pen further, it dilates. So now I'm going to do the Snellen and E chart. So I have a chart prepared for you. Just tell me the letter on the first. Well, read as much as you can. Just go ahead and read the letter.
E, T, P, Q, I, T, U.
Okay, that's good. So the patient has 20/20 vision. That's all I'm saying. And now I'm gonna check the pupillary reflexes. I'm gonna turn the light off. I'm gonna check the pupillary reflex. Pupils are equal, round, and accommodates to the light properly. And then, so I'm done assessing the patient's eyes. Now I'm gonna go ahead and assess her nose. There's no drainage, the skin is intact, there's no lesions or bumps. And I'm gonna go ahead and check her cranial nerve number 1. So I have a alcohol pad. She does not have an alcohol pad. I'm gonna make her smell it and identify it. So what do you smell?
Alcohol.
Okay, perfect. So now I'm gonna check the patient's ears. With observation, there's no lesions, bumps, or any masses. I'm gonna go ahead and palpate and make sure there's no bumps, and there's nothing. So now I'm gonna check the tympanic membrane with the pen light. Okay. Her tympanic membrane is shiny and gray, and there's no lesions or bumps on her tympanic membrane. So now I'm gonna do the Romberg test. So can you please stand up? And then just close your eyes. I'm gonna check for swaying. Okay? Perfect. You can go ahead and sit down. I'm gonna do the Weber and Ryan test. So this is my tongue. Okay, and tell me if you hear it.
Yes.
The air conduction is greater than bone conduction. So now I'm gonna go ahead and check the patient's mouth. Okay, I'm gonna check the patient's mouth, and I'm gonna assess like inspect it for any lesions or bumps, and her mouth is fine. And I'm gonna check her, cranial nerves 9, 10, and 12 right now. So first, open your mouth, pull your tongue out, okay? Perfect. And then please swallow. And do you have any difficulty swallowing or anything? And when I checked her gag reflex was perfect with the tongue depressor. So, put your mask up. So now I'm gonna assess cranial nerve 11. So do me a favor, I'm gonna move you up a little bit. Just pull your shoulders up and down. All right, and cranial nerve 11 is intact. So now I'm gonna go ahead and check the neck, assess the full neck assessment. So first with palpation, I don't feel the thyroid, and I don't feel any palpable lymph nodes. So I'm gonna go ahead and label the lymph nodes. Okay, so now I'm gonna name all of the lymph nodes. Preauricular, postauricular, occipital, mandibular, submandibular, cervical, supraclavicular. Her lymph nodes were not palpable, and if they were movable and firm. Okay, so now I'm gonna go ahead and check her thyroid. So just follow for me. Okay, perfect. And her thyroids are not palpable. So next, I'm gonna go ahead and do an assessment on her chest. So let me get my stethoscope. 3 minutes. I have 3 minutes. So now I'm gonna do a chest and respiratory assessment on the patient. So first, I'm gonna inspect her chest, and there's no lesions or any drainage or anything coming from her chest. Her skin is all the same color and there's no issues. So now I'm gonna go ahead and start her respiratory. I'm gonna auscultate her lungs. I'm sorry, this is inappropriate. I have to do this. All right, her lung sounds are normal, and the sounds are normal bilaterally. I'm gonna go ahead and just check her lung sounds on the back, on her posterior portion. Okay, so everything was fine. I'm just gonna quickly check for fremitus. Every time I press on your back, say 99.
99, 99, 99.
Okay, and the sound goes lower as I descend on her back. And I felt no crepitus or any like abnormal sounds, or heard any abnormal sounds. So now we're gonna go ahead and do her heart. So now I'm gonna assess the heart. I'm gonna do first, do her heart rate, where her pulse is. I'm gonna count for 30 seconds. Okay, her heart rate is 62. And now I'm gonna go ahead and name the traditional locations of her heart. So her aortic valve is on the second intercostal space to the right of the sternal border. On the left of the sternal border, we have her pulmonic valve. The pulmonic valve is in the second intercostal space. Then on the third intercostal space, we have the Erb's point. And then we have our tricuspid in the fourth, and then mitral or apical on the fifth against the sternal border. So now we're gonna go ahead and do her capillary refill test. Okay, and it's less than 2 seconds refill. And now I'm gonna so now we're gonna locate the pulse sites. So we have temporal, we have carotid, we have, brachial, then we have radial, then we have femoral, then we have popliteal, and then we have, endodorsalis pedis on her foot. So now we're gonna do a quick range of motion. So can you stand up for me, please? Okay, and then I just need you to abduct and adduct your arm. Okay, and do it against resistance. Okay, that's good. And now I'm gonna auscultate the patient, now I'm gonna assess the patient's bowel sounds, and assess her abdomen. So first I'm gonna auscultate. I'm gonna start from the right lower quadrant and go clockwise. I really hear it though.
You do?
Mm.
Alright.
Okay, so I heard 5 to 30 clicks in each quadrant, and the bowel sounds were normal. Okay, so now I'm gonna palpate. And then I'm gonna percuss. All her abdominal sounds were normal. All bowel sounds were within ranges, and that would complete our head to toe assessment.